The Corona war's most shameful face. Non-stop attacks on healthcare heroes. Not a day goes by without a doctor attacked. No mercy even for doctors dying on duty. India's most ignorant and ruthless. Medics now cry, enough is enough. The medical world wants special laws. Protect us from corona villains. On India Today, we declare zero tolerance. Touch our health heroes at your peril. India must unite to save our saviors. Today, our big spotlight on 5 Live is going to be on asymptomatic cases of coronavirus, because as much as 80% of COVID-19 cases across the world, including here in India, could be asymptomatic, which means people who don't have symptoms, don't know they're infected, and are carrying on with their lives and perhaps spreading the virus like never before. It's a big threat, and I'm going to answer many of your questions with experts right here on 5 Live. Think about this figure, ladies and gentlemen. 80% of COVID-19 cases, not just in India but across the world, could actually be asymptomatic. The number ranges from anywhere between 50 and 80%. That means a large majority of COVID-19 patients across the world may be asymptomatic. These are people who are infected even while displaying no symptoms at all, and a large number of those persons may not even know that they are COVID-19 positive. They are blissfully unaware and possibly spreading the virus to others, because if I was asymptomatic but I had COVID-19, I'd carry on with my normal life and inadvertently spread that virus. Asymptomatic transmission is now believed to be the coronavirus's true stealthy power, because it infects you, you don't know you're infected, and you're passing it on to others. Asymptomatic is now deemed to be the silent threat that could lead to an explosion of COVID-19 cases, and I will explain with experts right here on 5 Live over the next 20 minutes. The fight to contain COVID-19's pandemic has become much tougher now, as this new threat of asymptomatic cases has come to the fore. Asymptomatic, as the name suggests, simply means someone who's infected but does not have any of the symptoms. The Health Ministry on Monday has revealed that as much as 80% of positive COVID-19 cases across the globe are asymptomatic or show very mild symptoms. The revelation comes to the fore after Chief Ministers of Maharashtra and Delhi said that there were a high number of asymptomatic cases in the 2 worst hit parts of the country. The Indian Council for Medical Research has termed the rise in asymptomatic cases a challenge because it's difficult to track them. How do you know they're infected when there are no symptoms? However, it said that India cannot go in for mass testing due to the huge population, financial implications, and of course, infrastructural issues.
हम जो बोल रहे हैं 100 में से 80 रहते हैं, वो एक ही स्टडी है, ये बार बार बोल रहे हैं। दूसरी बात, जब हम एसिम्प्टोमेटिक की बात करते हैं तो जब कोई लक्षण बहुत कम होगा, पेशेंट खुद होके रिपोर्ट करने का चांस उतना ही कम हो जाता है। अब तीसरा तथ्य जो मैं अभी तक बोला नहीं हूँ, उसके बारे में बोल देता हूँ कि जितने अभी टेस्ट हुए हैं उनमें अगर आपने देखा तो सिम्प्टोमेटिक 31% है, और जो एसिम्प्टोमेटिक लोग थे उनकी संख्या 69% है। इसका मायना आप अलग ढंग से अगर देखें तो अगर एक केस डिटेक्ट हो रही है तो उसके साथ में एसिम्प्टोमेटिक, एक एवरेज बता रहा हूँ क्योंकि ये कॉन्टैक्ट ट्रेसिंग करके आए वाले पेशेंट्स हैं, तो उनमें हमको कितना दिखाई दे रहा है, 3 केसेस ज़्यादा से ज़्यादा, 3 शायद रहेंगे, 3 नहीं, 2 केसेस रहेंगे।
So now let's tell you about these asymptomatic cases, which the ICMR you've just heard declares as many as 80% of cases around the world and also in India could be asymptomatic. Point number one, and listen very carefully, ladies and gentlemen, this involves all of us, because if we don't have symptoms, how do we know we don't have COVID-19? COVID-19 is proven to spread silently without symptoms. That is proven beyond doubt already. Point number two, asymptomatic patients carry on with their life and they infect others because they don't know. There are no indicators that they are suffering from COVID-19. Point number three, unknown numbers of asymptomatic patients in India have been mingling with populations, and that is possibly responsible for some of the big explosions. Point number four, the true scale of asymptomatic transmission is still unknown because it's easy to guess. There is no data. How do you actually track such a vague mass like asymptomatic populations? Number five, it makes tracking COVID-19 spread extremely difficult and extremely ambiguous. Now let's take a look at some data. There is very little data, but I've filtered it down for you so you can make some sense of it. The asymptomatic cases in India so far. These are disturbing figures, I must warn you. In Delhi, as much as 25% of COVID-19 patients are asymptomatic. In Maharashtra, that number is 67%, which begs the question, how many more could be asymptomatic who are not designated as COVID-19 positive just yet? Karnataka, half the total number of COVID-19 patients are asymptomatic. 75% in Uttar Pradesh are asymptomatic. In Punjab, 75%. In Assam, 82% of COVID-19 patients are asymptomatic, which means they don't have any symptoms at all. And here are what it looks like on the global scale. In China, 25% of COVID-19 patients asymptomatic. In USA, 25% totally asymptomatic. South Korea, which has had a large number of cases, 30% are asymptomatic. In Japan, 18% are totally asymptomatic. Now I want to tell you, since I'm using the word asymptomatic a lot, and it's called the silent spreader, there are actually three types of asymptomatic, three types of persons who may not have these symptoms. And it's important that you stay with me to understand what these three types are, because this could actually apply to one of you. So listen very carefully. The number one type is the generic asymptomatic case. This is a person who's infected by COVID-19 by another patient but feels fine and therefore carries on with life. The second type is a pre-symptomatic patient. This is a person who's been infected by a COVID-19 patient, but the symptoms are yet to manifest themselves. So the person feels fine, has the virus, but is still carrying on with life and probably transmitting it to others because the symptoms have not shown up just yet. The third and very dangerous one is the mildly symptomatic. How many of us have felt slightly unwell over the last few weeks since the pandemic broke? We've sneezed, we've coughed, we've had a sore throat, but we've ignored it because sometimes there are mild symptoms. You feel unwell, but you carry on meeting people because you don't think it's COVID-19. There's a possibility it could be, but there are no clear standard operating procedures. How can asymptomatic cases be identified? There are many frequently asked questions, and I want to take you right through them while I also introduce our first guest today, who's an expert. Dr. Swapnil Parikh is a physician with the Jaslok Hospital in Mumbai, and he's also an author of the newly released book on the coronavirus. Dr. Parikh, always a pleasure. Thank you for being with us. You know, we've got some frequently asked questions that we have on our screen right now. And this is a bit of a disturbing area to talk about, Swapnil, because people are worried. You know, when we say asymptomatic, anybody could be asymptomatic and a COVID-19 patient. What is the first thing you would say about this asymptomatic phenomenon, Swapnil? Everybody is very curious in the country right now.
Shiv, thank you for having me on. It's always a pleasure to be here. I just want to say you've already done such a good job of explaining it. I don't think there's too much more I can improve on. But what I will say is...
No, we always need experts on this topic.
So what I will say is, you know, back in February when I wrote this book, The Coronavirus, we put most of this in there then because, you know, we knew based on data. What the distinction you made between asymptomatic who have no symptoms And pre-symptomatic is an important one because some of these people will eventually become sick. The USS Theodore Roosevelt, it's a aircraft carrier. And on that, they tested all the personnel there. And 60% of them had no symptoms. 60% of the positives had no symptoms. So now this is really good data.
Yes.
And this tells you what we're dealing with. To put this into perspective, the SARS epidemic in 2003, there were about 8,000 cases and close to 800 people died. 770 people died. It was a more lethal virus. The SARS-CoV-2 virus, which caused the COVID-19 pandemic, has so far infected about 2.5 million people and has caused 1.5 lakh deaths. It's less destructive to the individual, but because it spreads invisibly, as overall it's going to cause so much more damage. This just highlights the need of testing. And like you said, India is a poor country. It's going to be difficult for us to test everyone at scale. But, you know, back in April, on the 7th of April, I proposed this solution to the government of India, and I'm happy to tell you that it's actually being implemented now in conjunction with the WHO. So if you can see this, what this is wastewater surveillance. So instead of testing the individual, what you do is you test the sewage. And in the sewage, you can detect the virus. So if you look at this little graphic, if you can see it, you can see this is the main sewage treatment plant. And you can test the virus in this sewage treatment plant. And then you can follow it back at the substations. You can follow at this substation, this substation, this substation here. And wherever you see the virus, you can eventually reach the hotspot. And then in that hotspot, you can do intensive testing. So this allows us to not only detect the people who are positive, it allows us to detect the people who are pre-symptomatic, asymptomatic, mildly symptomatic. And we already have this system in place.
Swapnil?
It's called the... Yes.
The specific question we get, people are likely to be very daunted when they hear about how asymptomatic silent spreaders could be a big threat. What would you say to people? There may be people out there saying, what do I do if I get a little bit of a cough or a cold? Are there any standard operating procedures that are laid down either by the government or the health system, to identify asymptomatic carriers of the coronavirus right now? What do I do if I suspect maybe that I may be a carrier, but I have no symptoms?
So, of course, even if you have the slightest symptoms, any kind of symptoms, fever, cough, sore throat, even if it's really mild, stay home. It's the single most important thing you can do to save lives. Stay home and isolate yourself from your family members as well. Assign one healthy, fit individual to look after you. In terms of asymptomatic, by definition, you can't know. So you have to assume everyone is potentially infected. So to protect yourself, the best operating strategy is follow precautions, like keep social distance, minimize going into crowded areas, follow lockdown procedures, maintain hand hygiene, maintain respiratory hygiene. So when you cough, don't cough into the open, don't cough onto your hands, cough into your elbow like that. Avoid touching your face. So the same steps that the WHO and all health bodies have been talking about for the last 2 or 3 months.
You're basically saying that, to beat this virus, and especially the suspicions of whether we may be asymptomatic or not, to beat this virus, all of us need to basically pretend like we already have the virus. Isn't that what you're saying?
That we and as well everyone around us. So you have to assume this is everywhere. And at an individual level, that means taking these precautions very, very seriously. And this is important. This is not just for a short while. This is going to be around for a long while. We are just at the beginning of the pandemic. We are early in the pandemic. This is going to be our way of life for a long, long time, for a year, maybe a year and a half. So we need to get used to this, and we need to prepare. Know thy enemy. That's the first principle of fighting a pandemic.
No, I think that these two principles, know your enemy, don't panic, but also pretend like it's everywhere. Pretend like it's everywhere around you. And the lockdown means that you need to almost practically tell yourself that you already have the virus or that the people around you have the virus. And that's the reason why social distancing is so important. And like Swapnil just said, if you have the slightest symptom, don't ignore it. There are ways in which you can figure out whether it's something that requires COVID-19 specific attention. Swapnil, stay with me. other experts as well. Swapnil is one of India's finest voices on this pandemic, but we've spoken to other experts as well from across the world on the phenomenon of asymptomatic transmission. Here's what some of them say.
Asymptomatic cases absolutely can transmit the virus. As I mentioned at the beginning of our conversation, when it's replicating in your nasal passages, you may not feel that, or maybe it's just a mild irritation. You don't even think that you're infected. And yet it's precisely from the upper respiratory tract that you are spreading it to others just by speaking. We have to be much more mindful, of our role in transmitting this virus, regardless of how we feel. You may say you're not infected, fine, wear a mask anyway, just in case you are. And you're doing it not for yourself. At that point, if you're infected, you're doing it for everybody else, people you love.
I think this is data which has been coming for the last few days or weeks, that we have probably underestimated the number of individuals who are asymptomatic, and especially younger age group people who could have no symptoms but could have the virus and maybe spreading it. We must remember those who are not coughing, and if the chance of them spreading it is relatively lower, they still will have a chance of spreading the infection. And it seems that this number is not very low. Initially it was felt it is 15 to 20% only. More recent data suggests that it could be higher. Also, there is another thing that is also emerging, that people who are even symptomatic may be spreading the disease 1 or 2 days before they develop symptoms, and that also is a cause of concern.
तो वो तो हमने पहले भी बहुत बार बताया है, 100 लोगों को अगर इन्फेक्शन हुआ तो उसमें से 80 लोगों को इन्फेक्शन उसमें कोई लक्षण दिखाई नहीं देता. वो दिखने को भले एसिम्प्टोमेटिक रहे, उसको अगर हम जांच करें तो उसकी भी टेस्ट पॉजिटिव आने का चांस रहता है.
Swapnil is still with me, and remember, there have been many asymptomatic cases. You heard the story about a large number of journalists in Mumbai who've tested positive for COVID-19. They're all asymptomatic. A large number of journalists in Chennai are reported to have tested COVID-19 positive. They've also turned out to be almost completely asymptomatic. The question that I will ask, and we've got a lot of frequently asked questions on asymptomatic transmission. It's beyond doubt, Dr. Parikh, that asymptomatic patients can transmit the virus. It can transmit even during the pre-symptomatic phase. My question to you now is, could asymptomatic transmission, and I'm speaking of the Indian context, could it lead still to a large explosion of cases in the country?
Shiv, I think we definitely are going to, not definitely, we're likely to see a large explosion of cases. We have enacted a lockdown, so this is going to slow it down a little, but we are going to see an eventual number of cases. With a virus like this, it's going to keep going until about 50 to 70% of the population has immunity. And we just need to slow this down. We need to spread this down and keep it as low as possible for as long as possible. So until you have a vaccine or an effective treatment, neither of which are on the horizon right now, the only thing we can do is prevent as many infections as possible for as long as possible. And just to add, one statistic, one interesting statistic, even for people who become symptomatic, 40% of the people they infect is before they develop symptoms. So it's not just the asymptomatics, but the pre-symptomatics. 40% of the infections that occur are before the person develops symptoms.
Swapnil, always a pleasure. Always feel more enlightened, as do my viewers, when we have you on the show. Thank you. I wanted to devote some time to the asymptomatic situation because it's a vague situation. It's scary also because it's also very close. People are going to be wondering, I had a bit of a sore throat. I've been coughing a little lately, but I don't feel so bad that I need to, isolate myself from everyone else. So this is something I hope people have got their answers from this conversation. Look forward to having you on with us again soon. Swapnil, thank you very much for being with me here on 5 Live. We've got some breaking news coming in now. Okay, some good news coming in from the government. A total of 705 people have recovered from COVID-19 in the last 24 hours. It is the largest single-day surge in recoveries from the coronavirus that India has recorded thus far. And the number of total recoveries now touches 3,200 752. Yes, there are certain disclaimers we can put in terms of the definition of recovery and the possibility of reinfections. But as we understand recoveries of the COVID-19 disease, 705 people have been declared negative COVID-19 in the last 24 hours, and it is India's biggest single day recoveries recorded so far. India Today's Poulomi Saha breaking the story first here on India Today. Some good news amidst the other worrying data, Poulomi. Single biggest case of recoveries in the country, 705, not a small number.
Definitely not a small number, and definitely, instills some sense of hope in those who are working in the healthcare business, constantly trying to battle this disease. Now, what we're learning from the health ministry is that our recovery rate has improved to, of course, 17.48%. The doubling rate, the growth rate of the virus and confirmed cases across India is also slowing down. Certainly, there are some states which have more good news than others as well. 61 districts in 23 states, Shiv, which have not reported any new case of COVID-19 in the last 14 days. So that is very heartening news that is coming in right now. And obviously, we're ramping up testing as well. So you will see a spike in numbers in terms of samples being tested and in terms of confirmation of cases, because like you were discussing, there are several asymptomatic patients out there. But this is only a good thing, because we do want to ensure that the spread of the healthcare system and infrastructure is far and wide now, given that we have the wherewithal. The resources are constantly being ramped up right now. But yes, Good news on the other side as well, that 705 people in one day have recovered in the last 24 hours.
Definitely good news, and we'd like to wish the best to all of the families of those 705 people who've recovered, and hope that every single person who is currently suffering from the virus also makes a full recovery. Thank you very much, Poulomi, for that. Love Agarwal of the Home Ministry just released that information. Here's what he said at the press conference that Poulomi is reporting from.
अब तक देश में 3,252 लोग जो हैं वो क्योर हो चुके हैं. कल सबसे ज़्यादा संख्या में 705 लोग रिकवर हुए हैं, क्योर हुए हैं, एंड इट टेक्स आवर रिकवरी परसेंटेज टू 17.48%.
The Corona War's most shameful face. Non-stop attacks on healthcare heroes. Not a day goes by without a doctor attacked. No mercy even for doctors dying on duty. India's most ignorant and ruthless. Medics now cry, enough is enough. The medical world wants special laws. Protect us from corona villains. On India Today, we declare zero tolerance. Touch our health heroes at your peril. India must unite to save our saviors. Absolute shame. Not a single day has gone by in this lockdown of ours here in India without a healthcare worker, a doctor, or a policeman being assaulted by some ignorant thug somewhere in this country. A day after one of Chennai's most popular neurosurgeons, Dr. Simon Hercules, was denied a burial by locals of Kilpauk in Chennai, India Today has accessed disturbing pictures of the attack itself for the first time on television. The attack on the ambulance which carried the remains of Dr. Simon. On your screen are pictures of the aftermath. How locals hold sticks and stones attacked the ambulance outside the Kilpauk cemetery. The ambulance was completely vandalized. The driver was badly injured. He was hit on his head and was taken to a hospital for treatment. The incident has triggered a massive, widespread wave of condemnation and anger over the impunity with which locals take the law into their own hands, influenced by superstition, stigma, and pure ignorance. To Anandi Simon, wife of Dr. Simon Hercules, in this conversation just hours after her husband had passed away. Here's what she said.
அப்ப அங்க வந்த அந்த ஏரியால மக்கள் வந்த ப்ரொடெஸ்ட் பண்ணிருக்கோம்.
இப்போ அந்த ஏரியாவுல உள்ளவங்க இப்படி எல்லாம் பண்ணதுனால நம்ம இந்த திருப்பி எப்படியோ சிரமப்பட்டு நாங்க கண்ணால பார்க்கவே இல்லை. உங்களுக்கு அவங்கள அடக்கம் பண்ணும்போது எங்க 2 கண்ணால பார்க்கவே இல்லை. அப்போ இவ்வளவு தமிழ்நாட்டு மக்களுக்கே உழைச்சி ஊரை விட்டு வெளியில போகாம இங்கே இருந்து பார்த்து அவங்களால வந்த கொரோனா வியாதியினால இறந்திருக்காங்க. அப்போ எங்க முறைப்படி ஒரு அடக்கோணி அவங்கள பண்ணாண்டாமா அநாத பணமா சுடுகாட்டுல அடக்கம் பண்ணியிருக்காங்க.
And Shalini is live with me on this story. Shalini, absolutely heartbreaking, that conversation with Anandi Simon, the wife of Dr. Simon Hercules, whose body wasn't permitted to be buried by those locals who indulged in the most shameful violence in Chennai, one of India's most progressive cities. It's shocking to continue to track this case. But what is the latest, Shalini? Have there been any arrests? Have people been taken to to task about this? What is the investigation telling us?
Well, Shiv, as of now, 21 people have been arrested from Ananagar. These are people who blocked the ambulance and attacked the ambulance. Now, just imagine how humanity has actually degraded. There's the remains of a doctor who has served patients for 35 years, been taken to Kilpok. People stand there in protest outside the cemetery. This after the family has taken permission from the local priest and informed the corporation that this is where they want him buried. From there, the ambulance is diverted. The corporation officials take him to a cemetery in Ananagar, saying this is where we'll bury him. Now, the family says, okay, they don't see him. They don't get to say goodbyes. But over there, as they were taking the mortal remains to bury the remains, you have people come, throw sticks, stones, attack people, that the doctors there, the sanitation workers, the ambulance driver, those who were injured left the body there and ran away. This is extremely shocking. Today, the Chennai Police Commissioner did hold a press conference where he said, we have arrested 21 people and we are still looking out for the others. If anything like this happens again, we are going to take them all under the book of law, under the Gundas Act, and we are going to be very strict about this. And you know what's heartbreaking? When I spoke to Anandi Simon, the wife of the late doctor, what she said is, my only appeal to the Chief Minister and the Prime Minister is to have my husband buried in the cemetery where we can see him, where we can put a tombstone for him, where he knows this is where he's buried.
Exactly.
My children want to see that. I want to see that. He was a man who served the society. He was the man who helped people, and he was buried with such disrespect, and this shouldn't happen. It's very heartbreaking, Shiva, what's going on in Chennai.
It's heartbreaking, it's infuriating, and that is the reason why here in India today we are declaring zero tolerance. You'll notice that here on 5 Live especially, we will continue to highlight these stories no matter which part of the country they come from. This time it's in Chennai. Shalini, thank you for that update. The next version of this story comes from neighboring Karnataka, this time in Mysuru. Also a progressive city, but take a look at how a healthcare worker was treated there. Another bid to attack corona healthcare workers in Karnataka. Civic staff assaulted in Bengaluru yesterday, and today an Asha healthcare worker is assaulted and abused in the most ugly manner in Mysuru by 3 men after she asked them to wear masks and follow the sanitization protocol. The men took offense and had a verbal argument with the healthcare workers, showering her with expletives and abuse. Locals, however, intervened and protected the health worker, thankfully, from getting possibly physically assaulted. The police have taken note of the incident and says it will make arrests very soon. The incident comes just a day after civic officials were attacked in Bengaluru on Sunday night. The attackers were the ones who were refusing to be quarantined inside a hotspot. Chief Minister Yediyurappa has warned of strict action against those who violate lockdown norms. And I want to play out for you the video from Mysuru for just a moment with a sound up to just see the behavior of these men at this healthcare worker. One hapless woman against these men. Okay, I want to go across to India Today's Nolan Pinto for more now. Nolan, have any arrests been made of these shameless characters who attacked that one healthcare worker who was simply doing her job and reminding them to wear their face masks and follow sanitization protocol.
Well, in fact, the police over there in Mysore, this is what our sources tell us, saying that they will arrest these 3 people. The police are not going to allow these people to go scot-free. Now, Shiv, it's very, very tragic, if one could actually call this. All this ASHA volunteer wanted them to do was to maintain social distancing and wear a mask. Now, this is compulsory when you go out, especially in the public. Because she told them to wear a mask and not sit close to each other, that is when they went to attack her and abused her in the most disgusting manner. Thankfully, Shiv, it is those people, their presence of mind that saved her. But the Chief Minister has made it very, very clear, Shiv, for any of these individuals who attack Corona warriors, they will be punished.
I hope so. There are no arrests just yet, so I'm wondering what the Karnataka police is actually doing, considering that the Karnataka government hasn't covered itself in much glory in terms of setting an example against Corona villains and COVIDiots is concerned. So let's hope that healthcare workers at least have the assurance that they can work in safety during these very difficult times. Nolan, thank you very much for that. If you don't believe the fact that every single day of this lockdown here in India has produced at least one incident of this kind, like what you've just seen in Bengaluru or in Mysuru or in Chennai, here are the top 10. I've just picked 10 and I've covered all of these stories here on 5 Live. Viewers of this show will know. Take a look at the top 10 that I've picked out for you. These are images from all across the country. Whether it is Moradabad, whether it is Indore, whether it is Telangana, whether it is Delhi, whether it is other parts of the country, every part of this country has produced Corona villains who, for whatever reason, and I'm in no mood to be sympathetic to ignorance or misinformation, because the coronavirus is a crisis in which information has gone far and wide. So for someone to sit somewhere and say that we were misinformed and therefore we attacked healthcare workers, sorry, nobody's buying those excuses. Because look at how people have behaved in different parts of the country. Shamelessly attacking healthcare workers, shamelessly attacking sanitization staff, assaulting doctors, assaulting police officials, people who don't have a choice but to function on the very front lines of the corona crisis, and all of them have borne injuries. It's time to say enough is enough. What punishment for the people who indulge in such crimes? And things have reached such a point where doctors are so fearful. Just picture this situation for a second. Doctors and health workers are so wary, they're so scared about being attacked when they go out into the field or go out into localities, that the Indian Medical Association, the highest body in the country, has now declared that it will observe the 23rd of April as a black day to protest against the increasing number of attacks, some of which I've just highlighted for you here on the show. These attacks on doctors and frontline healthcare workers. Healthcare workers in the front line of the country's fight against COVID-19 have been serially targeted, abused, they've been attacked, many of them have suffered injuries. In a statement, the Indian Medical Association has said that doctors and hospitals will send out a white alert tomorrow by lighting a candle as a mark of protest. The IMA has also demanded that the central government enact a special law to punish those perpetrating violence against medical personnel. There have been several attacks on doctors, sanitation and healthcare workers across the country, including 2 cases just today. My colleague Nabila Jamal earlier spoke to the IMA president, Dr. Rajan Sharma. Here's what he said about the attacks on doctors and why the IMA has now said enough is enough.
22nd is a white alert. 23rd, we observe a black day, but only by wearing black badges across the country. Let me assure you and the countrymen, we will still keep on working and fighting this deadly disease. We are the only ones between the deadly COVID and you.
True.
Please protect us. Please respect us. This applies to the minority, fistful of people who indulge in such acts, and the silent majority which keeps on watching as bystanders.
And now some breaking news coming in on the Tablighi Jamaat cluster situation that's responsible for 30% of COVID-19 cases in the country. After evading the police for nearly a month now, Tablighi Jamaat chief Maulana Saad incredibly has formed a legal team. He has not given a statement. He's not submitted himself to the police despite repeated summons by the Delhi police, and now there is information that he has lawyered up. Look at the privilege of this man. After what he has caused in the country, he's now got himself a big high-profile team of lawyers. The team consists of 4 lawyers, and all of them will now be advisors to the Tablighi Jamaat and Maulana Saad. This is seen as an attempt by Maulana Saad to evade the police once again, and it only amplifies the massive long rope that's been given to this individual. The Delhi Police's crime branch has taken very serious note of Maulana Saad's refusal to come out and appear before the police in the Nizamuddin Markaz case. Remember, the Markaz alone is responsible for 30% of India's COVID-19 cases across the country. This after Maulana Saad, who faces a series of charges including culpable homicide not amounting to murder, had written to the crime branch saying his reply should be considered as him joining the probe. Look at the impunity and the privilege. Maulana Saad has also so far refused to get tested for COVID-19 despite being ordered to do so by the police. This even as he had asked his followers to get tested, but he himself has refused to do so. Remember, Maulana Saad is currently hiding inside his Delhi's residence in Zakir Nagar area. India Today's Arvind Ojha has gotten closer to Maulana Saad's hiding place in Delhi than any other journalist. He's been tracking all of this information. Arvind, Delhi police के पास अभी एक बड़ा सा डॉसियर है मौलाना साद के खिलाफ, और अभी जानकारी अभी मिला है कि मौलाना साद ने एक लीगल टीम भी रेडी किया है इस केस को फाइट करने के लिए. Okay, sadly we don't have audio with Arvind, so we'll try and re-establish that in just a moment. Arvind is tracking that story very closely. We'll get an update from him in just a short while. But in a related development, and I'll still try and get Arvind in, the Uttar Pradesh police on Monday night arrested 30 persons, including an Allahabad University professor, for hiding their travel history and breaching travel norms during the lockdown. The professor, Mohammad Shahid, allegedly gave refuge to Jamaatis who took part in the Nizamuddin Markaz event last month. An FIR has been filed against the professor. He's been booked under the Epidemic Diseases Act. Out of the 30 people who were arrested, 16 are foreign nationals. All have been caught on charges of violating foreign acts and involvement in conspiracy. All were staying without giving any information to the police, and all have been sent to a temporary jail, and their reports have been tested negative, thankfully, as of now. Let's go across to India Today's Shivendra for more. Shivendra, shocking story from Allahabad. 30 persons detained. It so happens that they have tested negative, but many of them foreign nationals, and all of them Jamaatis who had attended the Nizamuddin Markaz, which means these people were willfully being hidden.
See, Shiv, this is very shocking incident in which Yogi Adityanath, CM of Uttar Pradesh, clearly mentioned earlier also that whosoever is helping or hiding these people from Markaz or from anywhere who are infected or suspected for infection will be punished by the court of the law. That's what was made by officials, very clear by officials and Yogi Adityanath himself. But unfortunately, this Professor Mohammad Shahid from Prayagraj University, Central University, he was helping them and hiding them in Allahabad. That is very shocking and surprising. That's why administration has taken very strong step against him, and 30 people are being arrested from Prayagraj itself because they were hiding in Allahabad and this professor was helping him. They are arrested and case is being already registered. After quarantine period is over, they are all sent for temporary jail in Uttar Pradesh, which is made in different parts of Uttar Pradesh. Total 23 jails are being made for keeping these kind of convicts, these kind of people who are infected and quarantined by the administration. Now they are recovering, but they are all sent for this jail. And already, once again by the UP government, a strong message is given that whosoever is helping will be punished, and whosoever is, how much powerful is that person, that doesn't make a difference. That's why this Professor Mohammad Shahid is arrested and he was helping them continuously.
Well, it so happens that these persons have tested negative, at least for now, but that does not lessen the crime of them being hidden in this manner at a time when nationwide appeals have gone out saying that the Tablighi Jamaat event is responsible for 30% of direct or indirect infections of COVID-19. These people were still willfully being hidden. This is a question of breaking the law in a very serious situation, and they must pay the price for it. Shivendra, thank you very much for that. Many of those persons had attended the Tablighi Jamaat, and I want to go back now to India Today's Arvind Ojha, who's been tracking the Tablighi Jamaat chief, Maulana Saad. Arvind, if you can hear me. Maulana Saad abhi has not, he has not come out. उसने एक बार भी नहीं पुलिस से बात की है अभी तक अरविंद, और अभी उसने एक लीगल टीम भी तैयार किया है.
जी बिल्कुल, जब से क्राइम ब्रांच ने कोरोना टेस्ट करने के लिए कहा है, तब से मौलाना साद काफ़ी ज़्यादा परेशान है. हालांकि इंडिया टुडे ने उसके क्लोज तक जाने की कोशिश किया था, लेकिन वो ऐसी जगह पर बैठा है जानबूझकर जो हॉटस्पॉट जोन में आता है. और क्राइम ब्रांच ने यही कहा है कि जब उस मरकज से निकले बहुत से लोग कोरोना पॉजिटिव पाए गए तो आपको भी टेस्ट कराना चाहिए और इन्वेस्टिगेशन में ज्वाइन करना चाहिए. जरूर मैं आपको दिखाना चाहूँगा, दिल्ली क्राइम ब्रांच ने ये डोजियर तैयार किया है जो एक्सक्लूसिव इंडिया टुडे ने एक्सेस किया है. किस तरह से बड़ा सा एम्पायर जो है वो मौलाना साद ने खड़ा किया. ये डोजियर है जिसमें इस डोजियर में जितने भी नाम लिखे हुए हैं सभी क्राइम ब्रांच के रडार पर हैं लगातार. अब इन सब से पूछताछ होगी. इसमें कई नाम हैं जिसमें कुछ मौलाना साद के साथ FIR में जिनका नाम है, तो इन सब से अब लगातार पूछताछ होगी. इसके अलावा शिव आपको बताऊं कि 4 वकीलों की नई लीगल टीम मौलाना साद ने खड़ी की है जो अब उसका केस देखेंगे. तो यानी क्राइम ब्रांच से बचने के लिए मौलाना साद कोरोना का टेस्ट नहीं करा रहा है, जबकि बचने के लिए 4 वकीलों की फौज खड़ी कर दी है. इधर क्राइम ब्रांच ने एक नया डोजियर तैयार कर लिया जो इंडिया टुडे के पास है. अब ग्रिल करने की कोशिश, चारों तरफ से क्राइम ब्रांच उसको घेरने की कोशिश कर रही है.
Arvind, thank you very much for that comprehensive update. He's been running, he's been hiding, he's refused to get a coronavirus test, releasing all manner of audio, being booked at different levels of the Indian Penal Code, and now he's just lawyered up and he still hasn't submitted himself to the police. I will leave you to judge what that really means in this country. Well, if you're a tennis fan, and even if you're not a tennis fan around the world, you've been treated to some epic banter between the legends of the game, Rafael Nadal and Roger Federer, during a live chat on Instagram while in the lockdown. Enjoy this.
We make it? Finally. By God. Oh, I don't know if it was you or me. How are you doing?
It's sure myself.
Me too. I went in and out and in and out. I don't know how many times, but at the end,
but you know,
God.
We are old enough for all these things.
No. Oh God. You should have chosen a better guy.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.